Since when in your career have you ever heard or sat in an educational facility or medical school or a seminar of any kind, getting your continuation education hours? Since when have you ever in your lifetime and career ever heard someone say, it's best to wait in this scenario or this disease state for them to wait to get really sick before you treat them? Have you ever heard that?
Never in the history of humankind. Hey, you've got a broken bone with that bone sticking out your arm. Let's just let it fester for a couple weeks and see if it gets gangrene. Oh gosh, you have a bladder infection. Let's wait and see until you've got a complete kidney infection and need to be in the ICU. Well, gosh, you have walking pneumonia. Let's wait until you're in the ICU, then we'll treat you. Pure insanity. We've never in the history of medicine said, go home, let your lips turn blue. Oh gosh, when you're in extreme distress, then we'll decide to try to treat you with something. It's absurd.
Yeah, I've actually brought this up several times at different speaking engagements with medical doctors sitting all around me, and I'll go, since when? I mean, even in any scenario, I'm glad you brought up a broken bone, but I've actually said this with any parents, coaches of little league school or little league sports events. If a child sprained their ankle, would a parent or a non-health educated individual look at the kid and go, look, just wait 4 days till it's really swollen and then ice it? No.
Yeah.
Immediately, any scenario you're going to treat early and actually help them. Why are they avoiding all this early treatment talk? I don't get it.
And make him walk on that sprained, hurt ankle. We'll give him crutches in 2 weeks when he's really bad. No, you'd treat him right away. You'd help right away. That's common sense. That's morality. That's ethics. And we know that, COVID is an inflammatory clotting disease. Even if you don't use the drugs that shall not be named, there are countless anti-clotting, anti-inflammatory medicines that you can get on board early and right away that have wonderful effect as well. It's wonderful to get those antivirals on board that cannot be named. But at the same time, all these other anti-inflammatories and anti-clotting agents can save lives too. Going back to vitamin D real quick, most people don't know if you get D into normal levels, it has phenomenal anti-clotting effects. And COVID being a clotting disease, that's another reason vitamin D does so well, is it has phenomenal anti-clotting pathways as well.